So SOLTI PROMETEO trial is a trial focused on residual disease after neoadjuvant chemotherapy treatment. That means a patient who has received a standard of care neoadjuvant chemotherapy, multiple chemotherapy, and have residual disease that we confirm by biopsy and image with an MRA could be included in the trial, and they receive 4 cycles of T-VEC and oncolytic virus and the combination with Atezolizumab. After these 4 cycles, patients went to the surgery, and the primary endpoint was the rate of residual cancer burden, 0 or 1. The trial will include 28 patients, and we finished the trial. The last patient finished the surgery last March, and we will present the result in this meeting. So from the 28 patients that we were included, 20 patients were hormone receptor positive and 8 patients were triple negative breast cancer. And from this patient, we have a pathologic complete response of 25%. That means 1 of each 4 patients achieve a pathologic complete response after the combination of T-VEC and Atezolizumab. That means that we can, with this strategy, that increase the time of the neoadjuvant treatment or use new drugs after neoadjuvant chemotherapy in patients with residual disease, we can achieve the prognostic and we can achieve a pathologic complete response. Also, the second point that we have seen is that the pathologic complete response was not related with the overall response rate. No one of our patients with pathologic complete response has a partial response or complete response by image. There were also even progression disease with pathologic complete response. That means that, as we know, the immunotherapy treatment could increase the diameter of our tumors, but with a very good response. And the next step is try to look for new strategies for this patient that is a medical need. All we know that patients with residual disease has a very bad prognosis, more in the triple negative breast cancer, but also in the hormone receptor positive tumors. And we think that this window of opportunity between the neoadjuvant treatment and the surgery is a very good setting for trying new strategies. For example, we are running now a second PROMETEO, the PROMETEO 2 trial with CDK inhibitors and hormone therapy in hormone receptor positive HER2 negative tumor with residual disease after neoadjuvant chemotherapy. And also it's a very good setting look for new biomarkers in PROMETEO trial. We look for PD-L1 and TMB, different immune gene expression signature, and all see that during the treatment with T-VEC and Atezolizumab there is a huge increase of all these immune biomarkers.